Today we're going to basically do an introduction video to the use of Sim Man 3G. He's our high fidelity mannequin that we're going to be using in our training scenarios. He's a very technical mannequin who can do a lot, and we want to show you some of the basic things to use him and how best be prepared so when you get to the training situations we can jump right into the scenarios. So the nice thing about Sim Man is you're going to be able to see everything that is wrong with him instead of asking for an evaluator questions. So we're going to start off with our basic procedures on him and what he's capable of doing. First thing we're going to do is we're going to look at the airway. So as we start with any type of patient, we're going to see if this airway is open. Well, when we can visualize the airway, we can actually look into his mouth, see that it's open, see if there's anything in there. If he were to have a constricted airway, you are physically capable when you bag, you will get resistance. The other thing you'll see with him is, let's say our patient is cyanotic. What you'll be able to do is instead of us telling you that our patient is cyanotic, you'll actually get to see his mouth will turn blue and his lips will turn blue. So our next step after we've checked the airway is breathing. So you can see Sim Man physically has chest rise and fall. You're able to assess him to check his breathing rate, to see if he's getting full and equal chest rise, both sides. You're actually capable of listening to lung sounds, all quadrants, and we can change the type of lung sounds that he has, whether he has wheezes, rowels, rhonchi, absent, muffled. So instead of having to listen to a mannequin and us tell you, you will catch every sound with the patient. Because of the motor which allows for chest rise and fall, when your patient becomes apneic, you will physically watch the chest will stop rising and signify that your patient has stopped breathing. Next area we're going to check is circulation. So Sim Man is capable of having pulses in all the locations you would normally check any patient. The difference when you're checking pulses here is instead of trying to obstruct the vein and artery to get a pulse, here you will just set your fingers on your pulse points. There's an actual tube that comes through that gives pressure, and if you compress it, you won't feel anything. So make sure that you're just setting your fingers on those pulse point areas, as Sean is demonstrating here, with gentle pressure, and you will actually feel a pulse, or not feel a pulse. We're capable of putting the strength of the pulse and decreasing or making pulses absent at whichever particular pulse point we wish that to be. So for instance, we can have a pulse on the right foot, but absent on the left. The other thing Sim Man is capable of doing is bleeding. We're not going to show you that today, but as part of circulation, he will actually bleed and do either arterial bleed or venous bleed, which you'll have to control to continue with the simulation. Next aspect with most of our assessment we're going to do is vital signs. With vital signs, we have a blood pressure cuff, and Sim Man is required to use a specific cuff to get the exact pressures. So here you're able to do a manual blood pressure, and based on what we have programmed into Sim Man, you will get that exact reading on the blood pressure cuff. So the next step is doing our head-to-toe evaluation. We're able to do assessments on his head. As we're looking at his face, you can see we can actually change his pupils. So here, Sim Man appears to be fully dilated, and within seconds, we can go ahead and have him at pinpoint constriction. He is also able to completely respond. We can detach each eye, so one can be a fully dilated pupil, one can be fully constricted for indications of head injuries and other items. Other aspects of Sim Man is able to do is he's actually able to sweat, drain, and have fluids come out. So for instance, if he's going to be diaphoretic, you can actually watch as he starts to sweat from his head, drainage from his nose, his eyes. He will actually drain from his ears. And he can get frothing and fluid coming out of his mouth. So these help to make the simulation more realistic. Next aspect of Sim Man is we're also going to start to do a full check head to toe as we can assess his body as we normally would. So in order to do the next steps, what we're going to do is we're going to go over the equipment that we'll use with Sim Man. So this is the bag we're going to be using with Sim Man. What we have is the specialized tools to be used with him and hook up with our other equipment. In this top compartment, as you can see, we have the pen light, we have the stethoscope, and then we have the cables that are used to defibrillate, pace, and cardiovert Sim Man. This one has a special adapter, this yellow piece, that allows it to hook up to the LifePak units, whereas if you remove that, it can hook up to any AED that's out there. We'll use those specialized cables specifically for Sim Man instead of using pads. When we open the main compartment of the bag, the first pouch up top is going to be utilized for a lot of our airway equipment. So we have nasal cannula, non-rebreather masks, additional tubing, BiPAP, CPAP masks, and the nebulizer kit. So everything you need, and we'll talk about why each of these tools is specialized to be using with Sim Man particularly. Now as we look further into the main body of the bag, we'll have two trays. In here are going to be the medications used specifically for Sim Man. These are filled with a distilled water that's specifically used for him as opposed to any medication. Each of these medications are going to have a specialized tag which allows it to be used on Sim Man specifically. So it'll be recognizing when you're using a specific drug, amounts, and where it's located. Most of the drugs in this compartment are going to be drugs we'll be using on certain cases, whereas on a specific compartment of the bag, we have just ACLS drugs. We also have syringes that are used for drawing up the medications, and they all have a specific Velcro patch that you'll actually attach the RIFD tag to, so as that syringe approaches Sim Man, we can pick up what medication and what concentration is being used. This side compartment bag is going to be the IV kit. Now Sim Man already has an IV in place, as we'll show later, so we won't be doing specific IVs directly onto Sim Man, but we will be able to hook up fluid and run fluid in volumes, dopamine, and other products as well that they'll pick up. What Sim Man is capable of doing is running an IO on him, and he has a specific leg, which we'll show, has an IO leg to be able to do an IV through that route. In the other compartment, this is specifically our ACLS or our code drugs. So in here you're going to find those drugs we use in ACLS, like our sodium bicarb, dextrose, epi, atropine, and lidocaine. As you pull one of those out, you'll see that they have the tag on the syringe, so when you hook it up, the syringe and the tag will be identified by Sim Man as to what medication and what dosage you're using. And then the last compartment up in front is going to be a continuation of the airway. Here we're going to have our bag valve mask, which as you ventilate Sim Man, it will show up on our monitor, as well as the intubation kit. In the intubation kit, we'll have your ET tubes, your oral pharyngeal airways, your nasal pharyngeal airways, and all your blades. There'll also be your tube tamers, McGill forceps, and everything we'd normally find in your airway kit, including suction, King airways, and soon eye gels. The other thing he's capable to do is we can fully talk through him. He makes sounds. So you can actually hear when he's coughing, having difficulty breathing, if he were to vomit, moan in pain. And like I said, we as instructors can hook up a headset and completely speak through his speaker in his mouth and answer every question for him. If Sim Man stops breathing or needs assistance with ventilation, we can actually take the BVM, bag our patient, and he'll simulate those ventilations, and we can pick up how good of ventilations you're doing, the timing and rate that you're doing on your ventilations, and if you overventilate, he will actually get stomach distension as well, which you'll be able to see. As you can see, as his stomach is quite rising and getting distended if we overventilate. If we're going to use airway products, the computer in Sim Man will actually pick up when you're placing an item and know that you've placed something in, like the NPA or the RFID tag on the OPA. He has a sensor reading by his mouth that will pick up that the OPA was inserted, and based on what you have done, will work or if you place the OPA in with a gag reflex,
it won't work because he's not breathing. He has to have
he will go ahead and vomit and have sounds associated with. Okay. And with the Sim Man fully operational airway, so you can place the King airway in just as you would any other airway mannequin. With the RFID tag, it'd know that you did place the King or a supraglottic airway in place, as when we use the eye gels. And you can see fully functional. Unfortunately, what we're not going to be able to show here is you're able to intubate Sim Man. Sim Man is capable to have trismus, or tightening of the jaw. He's capable of having laryngospasms, full blockage of the airway, foreign bodies that you'll have to remove with McGill forceps. And if we have it so that you are unable to intubate Sim Man, he's fully set up, as you can see around his neck, for a quick trach or a surgical trach to be performed on him as well. Sim Man is also capable of getting tension pneumothoraxes that you may have to needle decompress. So you'll find the correct location, take the needle, and Sim Man will actually be able to tell that you pierced the cavity and will decompress the lungs. If you were to do CPR on Sim Man, he is also able to pick up your hand placement, make sure you're in the correct position, making sure you're doing the proper depth, and it also measures that rate of compression in which you are compressing the chest. The right arm already has an IV port in place with an RFID tag indicator, so that if you were to push any medication, it will read that medication and concentration based on the tag you are giving and the amount of fluids you give. You're also capable of hooking up any drip sets to that arm as well. Now, in some instances where we're unable to establish an IV, Sim Man is capable of getting an IO into his left leg. You'll be able to palpate the correct location and drill into his leg and start an IO and run fluid through there as well. Unfortunately, no medication through the IO, as there's no RFID tag reader in that location. We have two ways to monitor what is going on with Sim Man. One, we have this computer for your patient monitor. Here you're able to tap on the screen, it is a touchscreen computer, if you want to see what his 3 lead is. We also have the capability of watching what his CO2 waveform is. And this will bring it up on the screen and show exactly what he's detecting based on what we place on Sim Man. Now there's another aspect. I showed you about the manual blood pressure. Here we can do an automatic blood pressure by touching the screen and starting the blood pressure. You can actually get an automatic reading on the screen. Last thing with this particular area here as well is you can use the SpO2 monitor. In order the SpO2 monitor to actually read, you have to have it plugged into the laptop and then take the finger detector placed on Sim Man directly. Once that is done, as you can see, the waveform and the SpO2 automatically comes up on the screen. Now, if we need to do a 12 lead on this patient, if you'll look on this lower bar, press the side button there and you'll see 12 lead. When you press on the 12 lead, it will actually pull up the 12 lead that's associated with that particular scenario's rhythm we want you to see. So this is one of the ways we're going to be able to take a look at this. But in real life situations, a lot of times you guys are going to be using your LifePak 15s. So we also have the ability to use the LifePak 15. The LifePak 15, unfortunately, will only be able to use the 3 lead, will not be able to pick up the SpO2, the waveform, or the 12 leads on this. But what this use of the LifePak allows you to do is not only get the 3 lead on this, but cardiovert your patient, pace your patient, and defibrillate your patient. So our connections for Sim Man, first off, for the 3 lead is going to be standard limb lead placements, or what we call the core placements, as Sean is demonstrating here. And in order to pace Sim Man, to synchronize cardiovert, or to defibrillate him, you'll have to hook up the cables to him as we demonstrated earlier with the bag. Again, he does not respond to the patches. We'll have to use the specific cables that will attach to him and then hook up to your LifePak. Just like the patches, each of the cable leads show exactly where to place them on Sim Man. And just as you would hook up to the patches, you hook up to the cables instead. Now we're able to cardiovert, shock, and pace as needed based on the scenario, visualize our 3 lead on our LifePak, and fully be able to assess the changes on our computer as opposed to the instructor having to give you those changes. So this has been a brief tutorial on Sim Man. As we get to work with him, we're going to go in more in depth of what we can do and practice more with all the features that are available. Sim Man, as you can see, is a high fidelity mannequin. He's able to increase your training by doing real life scenarios and be very realistic in giving you the feedback instead of getting that from an evaluator. Because of that, he's a very expensive mannequin. We do expect you to treat him with care, treat him as you would an actual patient, and it's going to basically make your scenarios more realistic, make your practicing much better, and hopefully make you a better practicing EMT and paramedic in the field.